Hey guys, welcome back to my channel. If you are new here, then my name is Smita and I'm a nurse. So basically I make video upon healthcare or nursing related contents, but even if you are non-medical person, then you will get good knowledge about your health and the disease conditions. So today I'm going to tell you about blood transfusion and the care which you need to give before, during and after the blood transfusion. So even if you are a non-medical person, I insist you to watch this video till the end, because we do not know, some other day we all end up being in a hospital. So it is always good to have knowledge about other things as well. And if you are a nursing student or a nurse or some medical professional, then I highly recommend you to watch this video till the end. Let's get started. In blood transfusion, we transfuse blood or blood components through a IV line which is being connected to the vein of the patient and using a IV cannula, if you know. So blood transfusion is not something very common which we do for all the people, but only in certain cases we go for blood transfusion. So what are the conditions and what all are the situations where we have to go for blood transfusion? Let's see that. The first situation is when there is lack of oxygen carrying capacity in your blood. So just to increase that oxygen carrying capacity, we infuse blood to the person. So this second reason why we infuse the blood, in case when there is a loss of blood during the surgery. So there are some cases where there is a high chance of blood loss during the operation. So what we do in those cases, so the doctors usually gives an order to arrange 1 or 2 units of blood in advance. So when the patient is shifted to the OT, and if something like that happens, then immediately we transfuse blood without any delay. Then the third reason, in case your patient's hemoglobin is less than 6 mg per dl or lesser than that, in that case we go for immediate blood transfusion. So that condition is actually called as anemia. So if you are a person who is anemic and your hemoglobin level is very low, then you need to transfuse blood immediately. The fourth reason is internal bleeding. In certain cases like hemorrhoids and in some other cases, the persons get internal bleeding. Eventually a person will have lack of blood in the body, so we go for blood transfusion. Then the next reason is if the person has met any kind of accident, which is road traffic accident or maybe a gunshot or stabbing, any such cases which induces the loss of blood, in that case we immediately transfuse blood to the patient. And the last reason is the cancer. In certain types of cancer where the person's blood cells are not mature and maybe they are not capable of carrying oxygen or carrying out the normal activity, in that case we go for blood transfusion. So these were some of the reasons blood transfusion is required in these cases. Blood transfusion is not a very simple procedure where just you got a prescription and immediately you start with it, but it actually goes step by step. First of all, you need to do some arrangement, and those arrangements are: check for the prescription. If there is written prescription by the doctor, then only you are supposed to arrange for the blood and start blood transfusion. Second thing, before blood transfusion, you must know what is your patient's blood grouping and RH factor. If your patient is aware of his blood group, then you can just give the serum blood sample to the blood bank and get the blood arranged. In case the patient is not aware or maybe in doubt what is his blood group, then you are supposed to send EDT and serum sample both together to the blood bank and also do an ABO grouping for the patient. Third thing, which is very important before blood transfusion to happen, always take a written consent from your patient. According to your hospital policy, there is a blood transfusion consent form which is supposed to be explained to the patient very well. And as a nurse, you are supposed to explain the consent form to the patient before the patient signs on it. So once you explain the procedure, what is he undergoing for, and what are the side effects he can expect later or maybe during the procedure, after that only the patient is supposed to sign. Once the consent form is signed, you can actually start with the arrangement of blood. So now you have already sent the sample and blood arrangement is happening. So as a nurse, now your duty is to check your patient's vital signs and check for any comorbidities. So what is this comorbidities are? If your patient has any other disease like kidney failure, congestive heart failure, systemic overload. So in these cases, you need to call the physician and inform him about the patient's comorbidities and ask whether or not you have to transfuse blood even after these situations are present. What are the precautions and what are the pre-meds you need to start before or maybe during the transfusion? And the last but most importantly, you have to check for patients straight vein and put in cannula of 18 gauge or maybe larger than that. Do not go for some smaller size cannula because in that case the blood components may get breakdown while it is infused, and there is also a higher chance of blockade to happen. So it's always good to choose 18 gauge cannula for this case. Now, you should always keep in mind if your patient is getting any other fluids or antibiotics or some other medicines, that should be always given to another hand or maybe another side. Do not use same cannula for blood transfusion and other antibiotics. And now when everything is done, patient's blood is arranged, patient vitals are normal and IV cannula is put, and also check that it is patent. Now finally you can call the blood bank and ask them to send the blood back. In case the patient is getting more than 1 unit of blood, in that case also you are supposed to get only 1 unit of blood from the blood bank. Now when you receive the blood, call one of the doctor and one of the additional nurse to come with you and cross-verify if the blood which you have gotten from the blood bank matches with the patient's identification. And go to the patient side, ask the patient name and verify whether this is the same patient or not. Once the identification is done without any error, you can proceed further. But in case there was any error found, you are not supposed to infuse that blood and you have to return that blood back to the blood bank, stating the reason why you are returning it. Now, once the cross verification is done, you should keep in your mind you have to start the blood immediately after it is being released within 15 to 30 minutes. Not delay the transfusion because after 30 minutes the blood components start to degenerate and break down. So just to avoid any kind of complication or allergy to happen to the patient, it's always good to start soon after the blood is being released from the blood bank. And now the first 15 minutes when you start the transfusion, the nurse has to stay beside the patient and she has to take patient's vitals continuously. If there is any changes in patient's vital or patient feels any kind of dizziness, backache or headache or any kind of body or muscle pain, you are supposed to immediately stop the transfusion. And also remember, in these 15 minutes, you cannot increase the drop factor more than 5 ml per minute. Only after 15 minutes when your patient is completely fine and his vitals are normal, you can also increase the drop factor. Do remember that the blood or blood component has to be transfused only between 2 hours to 4 hours, because after 4 hours the bacteria start to proliferate into the blood. So it is always best to stay at the safer side to minimize the complication in your patient. Now talking about the adverse reaction. So with every treatment there is some or other adverse reaction associated with it. Even with the blood transfusion, there are some adverse reactions associated, which doesn't mean that every patient has to get these effects, but there are certain cases, there are some patients whose immunity responds in different way when they are getting donor's blood. So what are these adverse reactions you have to be very alert about? The first is circulatory overload. In case there is circulatory overload and patient's heart is not able to pump that amount of blood, in that case the patient can undergo to the congestive heart failure. The second thing is sepsis, which is very difficult to manage. Then patient can have febrile reaction, allergic reaction, acute hemolytic reaction, etc. So once your transfusion is over, you have to immediately flush it with normal saline 0.9%. Do not take any alternative fluids like dextrose or RL. Always go for normal saline because that is the only preferable fluid you are supposed to flush after the transfusion. And also discard your BT set or the blood transfusion set which we are using for blood transfusion purpose only. Discard it into the yellow bin, and if your hospital policy says, then you can just return back the blood back to the blood bank, and if not, then discard that too properly into the waste bin. Now, after the whole procedure is done successfully, document it into the patient's file correctly. Always try to make credibility, because as a nurse, you are always accountable to your patients. So in case there is any event which has happened during the transfusion process, do write it into the documentation. In case if there was any treatment or any medicine given during the transfusion, mention that also in your documentation. So it doesn't get over only here. Still, you have to take your patient's vital continuously and see if there is any kind of changes or any allergy is noted. Now, how will you know that the procedure was effective? So you send a blood sample after 1 hour of the procedure or maybe in the next morning and check for the blood values. At last, I want to tell you what are those blood components which we often use in the hospital. So it is whole blood, fresh frozen plasma, which is FFP, PRBC, which is your packed red blood cells, and albumin, which is your blood protein, and platelet. And there are also some other blood components which we do not use on a normal basis, but we do use it in some scenarios. So that was it about the blood transfusion procedure. And if in your hospital there are some other protocol which you are following, then do comment down and let me know what are your protocol which you prefer. So this was the end of my video. If you like it, then give it a big thumbs up. Comment down if you have any query regarding blood transfusion, and do subscribe to my channel because I am actually working hard towards it and I would love to extend my YouTube community. So if you haven't subscribed my channel yet, then do subscribe it, and also click on the all bell icon so whenever I upload any video you do not miss in the future. So bye bye, see you.